So what many people have started doing from years back, and especially knowing that enrollment was going to start, is they started pulling together information. These are nonprofit organizations, and many times they have a Tennessee focus like Tennessee Healthcare Campaign does. So if you find yourself with a question, you want to know more, you can delve into these resources and look for more. What I found as I started to do that was I could get easily overwhelmed. It's like taking a drink from a fire hydrant. Because there's so much good stuff out there. So one of the purposes of this workshop today has been to sort of cherry pick and bring together the things that are most applicable to our mission, the things that are going to help us to accomplish our goals the best, and that's there. But I do want you to know, that these resources are out there. You could get into this website or other websites that we'll talk about and find even better information. When you do that, bring that information back to the group. Bring it back to the Tennessee Democratic County Chairs Association, because really our role in the state is to be a conduit or a connector between different organizations of activists. And that's what county parties really are. They're really activists, people who want to get together and get something done and have the proactive leadership skills to take that upon themselves. So that's all I wanted to mention about that, Becky. And thank you so much for what you're doing with Tennessee Healthcare Campaign. And she's going to be our expert in the room today. So, because I'm not an expert, neither do you have to be. So what I'm going to do is kind of dive into this presentation. This is meant to be a nuts and bolts overview of a few of the things that have been going on with the Affordable Health Care Act and what is coming up next, which is full implementation through the marketplace. Like we were talking about before, this is not designed to make you an instant health care expert. This is so that you can get the overview of what's happening, find your way to the resources that would give you more information if you need it, but be able to answer some simple and basic questions for other people. Because if everyone in the United States has to become a health care expert in order to get health insurance, we're in trouble. That's not going to happen, and it doesn't need to happen. And the situation here in Tennessee is that we have to spread the word on this. You might have seen all of the TV commercials on TV for the Affordable Health Care Act, right? You didn't see those? Did you get a mailer? Have you gotten a lot of mailers in your mailbox telling people that enrollment's going to start? Oh, darn. I was supposed to get those sent out. Okay, so all the really positive press that's been in the newspapers and the media and the TV, that's got everybody really excited. Okay, I've seen a couple of great articles coming up recently. I saw an article where I'm from in Sumner County about 21,000 uninsured Tennesseans. And Mary sent me a spreadsheet, and I've gotten it from other people too. There are tens of thousands of uninsured Tennesseans in every county in this state. And they haven't seen the TV commercials either. They haven't gotten anything in their mailbox either. They haven't seen a bunch of overwhelmingly positive, happy press on their TV screens. So who is going to tell them? 400,000 folks or so are going to qualify for the affordable health care that's going to come through the marketplace. Are they going to overwhelm the system? Are they going to crash the system on October 1st? No, because they don't know about it yet. And that's what our focus is here today. How are we going to have enough information ourselves to tell our neighbors, our friends, our church folks, our kids' teachers, our soccer mates? How are we going to know enough to tell them? And then how are we going to get past those 50 or 100 or so people in our immediate circle and find the thousands and thousands of people in each of our counties that need to know? And there's ways that we're going to do that. And what I heard all of you say when you introduced yourselves is that you know that you need to do more to make this happen, and you're willing to do more. The question is, what is that more going to be? And it could be a lot of different choices. Like Jim, you could want to become a CAC. You could get together with Becky. You could get together with Mary. You could get a whole bunch more information than I can ever hope to give you. And you can find out how to do that and help people to enroll. The other thing you can do is you can decide to be on a lifesaver team. And that's what we're calling our groups of folks that are going to pass out nonpartisan, straight talk information to folks, be able to answer some questions, be able to place health care where it belongs. It's a life and death issue. Okay, this is a life and death issue for folks. So be able to talk about that. That's the rebuttal for almost every argument you're going to get out there on the street. Wait a minute, I hear what you're saying, but this is a life and death issue. Don't you want your neighbor to be able to have health care, to be able to have a cancer screening before they have cancer? I do. Don't you want your child to be able to have care for the rest of their lives if something happens to them instead of maxing out their lifetime benefit? I do. So that's my baseline rebuttal for everything. But I'm going to go ahead and jump into this, and I think we have a small enough group that if you have a really specific question about the slide that we're on as we're talking and you want to ask it, please raise your hand. If you have a question that's more extrapolated from what we're talking about, if you want to jot it down in your notes, because we are going to have a question and answer period, and we'll get to it with that. So these slides were sent to me by Donna Seeley. She's an RN and MSN certified family nurse practititioner, and it has a lot of great information in here, a lot of good basics. There's over 900,000 uninsured Tennesseans, about 16%. There's Tennesseans in every county who can get health care through our marketplace. And I meant to add this to this. The marketplace is healthcare.gov. The marketplace is healthcare.gov. Almost everyone you talk to needs to know that. Even if they don't have a computer at home, they need to know that that resource is there, that they can go to their local library, that they can go to their brother's or sister's house that has a computer, that has internet, and start getting information there. And that's the best resource for us as well. Over 400,000 folks would have been eligible for expanded Medicaid of that 900,000, except we haven't chosen to expand Medicaid yet. And that's right here at the front of this discussion, because what we have to do in our minds is sort of separate that a little bit. It's going to affect the full implementation greatly. But we don't want to get mixed up. I know a lot of people get mixed up between, well, we aren't having health care here. Governor Haslam said no. He can't say no to the marketplace. He can't say no to the affordable health care marketplace. What they said was we were not going to create our own state-facilitated plan. So we have a federally facilitated plan, and that's what healthcare.gov is. It's the federally facilitated plan. After October 1st, there will be all the prices, all the information that people need to go there and find out what they will pay for their specific health care if they need it. But as far as the expanded Medicaid, we're going to probably talk about that later in kind of a brainstorming session to talk about our activism, what we want to do about it. But for right now, the poorest of the poor, the folks who need it the most, right now the governor's chosen not to let them have health care. The health care law. We've got 3.1 million young adults covered on their parents' insurance now. That's already happened. That's part of the Affordable Health Care Act. And it's actually part of the patient protection. Have you ever seen it PPACA and wondered what the PP part stands for? That's patient protection. It's the Affordable Patient Protection and Affordable Health Care Act. 105 million Americans have had their lifetime limits removed. That means when you're really ill and you've spent a lot of money already, your insurance company has spent a lot of money already, they don't get to say, oops, pulling the plug. So that's a patient protection, right? 6.1 million Medicare recipients received $5.7 billion in prescription drug discounts. This is one of the ripple effects that the Affordable Health Care Act has into helping Medicare. When they say that it's hurting Medicare, they're not talking about this, because this is a great thing. And $2.1 billion was returned to consumers from insurance companies. Insurance companies can only make so much money. They can only put so much money into their CEO's salaries and their overhead. And if they make too much money on those things and they aren't providing the service that you've paid for, they have to give you a rebate. So that's another patient protection. Right now, there's 3 ways that the law changes things, 3 broad things to think about. What you buy when you buy health insurance, how you buy health insurance, and when you buy health insurance through the health insurance marketplace. So what you're getting, how you're getting it, and when you get it. Okay? So what you buy when you buy health insurance. Everybody wants to know that. And a lot of people who are going to be enrolling aren't going to have any experience with insurance, or very little, and won't really understand how insurance works. These are the 10 core things. And can anybody in here can just rattle off these 10 things already? Not Mary? Nah, not Mary. Becky's got it? I can't memorize 10 things. I can memorize 3 things. I can memorize 5 things. I have to have a piece of paper to have 10 things and get it right every time, unless I've learned lines for a show or something. So, and none of us are going to do that. None of us are going to sit down and study. So this is something that any flyer you hand out, I think, should have these 10 things, so that you've got that as a reference, they've got it as a reference, or at least have a poster of it or something. Now, the other thing is, Who's going to sit there and listen to you discuss all 10 things? All right? Like number 4, and they might not be in the same order on your flyer, I apologize. Maternal and newborn care, okay? You might be able to kind of pick and choose. Who do you think that might be the most important thing to when they walk up to your table? A pregnant lady, a lady with kids, maybe a grandma, you know? But there might be a lot of men, too, who want to know that their wife is going to have that kind of care. But first of all, when people go to the doctor, they go to office visits. They have an office visit, right? A lot of people just go to the emergency room, and they want to know, oh, am I going to be covered if I go to a doctor? Yes, you are. Hospitalization, if you need to be put in the hospital for something. Preventative and wellness care, so your cancer screenings, going in for a checkup and have your blood done every year to find out what your hemoglobin is, to find out what your cholesterol is, important stuff that people need to know to be able to manage their health. Prescriptions, lab and x-rays, emergency services, rehabilitative services, mental health services is included. I think that's so important because we've got to start seeing mental health services as part of what we need as our total health care package. Ma'am?
Does that include things like dementia and Alzheimer's and that?
Dementia and Alzheimer's and that. Well, Mary?
It includes them, but most of those are going to be under Medicare.
We've got all kinds of processes going on. So it's really important that you're going to have seamless coverage because mental health isn't going to be left out of this. And then pediatric services, of course, for our kids. So those are the 10 things that you are buying when you buy insurance.
And to add to pediatric, it includes for pediatrics dental and vision.
Ah.
Now, on dental, will that include braces?
I don't know.
And so there's no dental for adults, because that's something we really run into where we are.
Unless you buy a plan, you can choose a plan that has
It does
dental.
have it.
Yeah. It's not part of the 10 basics, the 10 essential core elements. So how do you, what she just started to talk about when you can choose a plan. You can choose a plan. How many of you have worked in a job where when it was enrollment time, if at your full-time job where you got your insurance through, you had a choice of several different plans to pick from? And did they call that like a cafeteria plan? Yeah, yeah. So you got used to the fact that you were going to take your needs and compare them to what was coming at you. Okay? A lot of the people that you're going to talk to are going to be completely unfamiliar with that concept. You're either in or you're out. It's a yes or a no. I can afford it or I can't. There's going to be lots of different levels of coverage. One of the things that we as outreach people are going to be cautioned not to do is speak about the particular plans, such as this Blue Cross and Blue Shield plan does this, this Cigna plan does that. I don't think there's any reason for someone at the outreach level to get into that level of detail, but you will have resources where if someone has those detailed questions, you can start getting into those. But you don't need to become an insurance broker, and in fact, the state has cautioned us not to be. So we'll talk about that in a while. But as far as these different levels, you can talk about it.